Dane County, Bonnie Koenig. Just before we get to her, I do want, we're on very limited time with her. In addition to everything else she's doing, she's also helping out at the recount, and she's just got so much going on. So her time with us is limited, but I do want to just share a few things with you guys as we look at the week ahead and kind of where we're at with this pandemic. I think one area that continues to get overlooked, which is maybe the most important out of all of what's happening right now, are those that have lost their lives to COVID-19, and especially this Thanksgiving. I want to acknowledge them and just, you know, the numbers are what they are. 257,000 lives lost in the country. 3,162 lives lost to COVID in our state. And right here in Dane County, 78 people have died from COVID. And so I just want to take a few seconds, if we can, for all of us to just acknowledge those lives in just a few seconds of silence. Thank you. I think it's important. That's what this is all about. And we continue to be grateful to Bonnie and to so many others who are helping us navigate through this to keep these numbers down. That's their goal. That's our goal. It stinks that we're all running businesses and trying to continue to pay staff and pay inventory and all of those things while this is going on. But we recognize that she and her team are here to help us through this and to keep these numbers down. That's the most important thing of all. I do have a video after we visit with Bonnie because she is on a time crunch. We have a new Mask Up campaign. Actually, maybe I'll show it now so Bonnie can see it. Let me hit my screen here. Can you all see that, Colin? Can you see that?
Yes, I can.
Okay.
We mask up for our customers and staff.
We mask up for each other.
Yeah. Yes.
Usamos la máscara por nuestra comunidad. We wear a mask for our community. Mask up!
So I wanted to share that we are going to be running that on local TV. We'll have a social media campaign with that, and it's business owners, it's people in our community that want to continue to ask people to mask up. As odd as it seems, there are some that are still not doing it. So with that, anyway, let's bring in Bonnie Koenig with Public Health, Madison, Dane County. Bonnie, good morning.
Good morning, Peggy. Thank you again for having me at this hour with new emergency orders. Happy to be here and get everybody up to speed of what can happen and what's not allowed to happen right now.
Again, in the spirit of Thanksgiving and always, we are grateful to you. I know that you are just working so hard. I know when you leave a voicemail for Bonnie, it used to be she'd get back to you right away, and now it's a 4 or 5 day because she's just got her arms around so much more. And I know it's most likely mentally draining to you, physically, to everybody at the staff. And we just wanted to say thank you again for being here, for helping us through all of this. We realize we can go to a website and read it. This is so much easier, and I think it makes more sense. So we have a number of questions lined up, but if you have a question for Bonnie, we only have her here for about another 20 minutes. But if you have a question, please leave it in the chat. Otherwise, I think obviously the biggest clarification is we want to clarify order number 10 when we talk about how it relates to indoor gatherings. If you could just clarify that for us before we get to the others.
Yes, right now, no gatherings can happen outside of your household or living unit, period. And we can talk a little bit more about how that extends into certain business sectors. Employees are excluded in a business when you're gathering. So if you were to do a one-on-one type of consultation as part of your business, that could still happen. You could still go to see your hairdresser, for instance. You could still have a contractor come to your home to do a service. However, you cannot be meeting with friends or family members that live outside of your household. at this moment in time, and there are no indoor gatherings that can be taking place at all. So no meetings, no trainings, no conferences, etc.
So just to, again, just to look at that, and I did not know, obviously employees are excluded from that, which is a great clarification. So just an example of this might be, you can go, you can provide a service if you're a service business, but if I'm a hairstylist, my client can come in, but my client and her husband or her sister cannot. It's one-on-one service, correct?
When we consider a gathering, we're looking at the household or living unit as one.
Oh,
So if I were to go in with somebody I live with, let's say I'm a mother and I want to bring my children in to get their hair cut, the three of us can go and see the hairdresser, because the three of us are considered one household or living unit, and we're only counted as one in that gathering. And the person doing the service is an employee and they're excluded. So that can still happen. But when these services are happening, we still want to remember to be wearing our face coverings at all times and to be physical distancing.
mm-hmm. That is a good clarification, because again, didn't know that. So thank you for clarifying that. I think that's really important.
I do see Denny has in the chat about trainings. Denny, I'm glad you're bringing this up. You can have trainings one-on-one, or if you're training two people that live together, they could be counted as one. But beyond that, no trainings can take place. No meetings can take place, no conferences. But if you can manage that in a way where you're just doing it one-on-one or with one household or living unit, that is meeting the order requirements.
I guess my question was more towards a business.
Mm-hmm.
A daycare center where they have employees who need the training for their licensure. Is there any reason why we can't do 10 if we take all the precautions of masking and everything else on? Is there any reason why we can't do a training class like that?
Yep. I'm sorry, Denny. Given the current orders that go through to December 16th, none of those trainings can take place in person indoors. And so we're hoping that there might be an opportunity for your business to do that remotely right now. And it is really unfortunate, but we can't. Employees, when you have, it's very clear in our orders, meetings, trainings, even within offices and businesses cannot be taking place right now because they are considered indoor gatherings.
Another question, again, these are somewhat in random order. Is it mandatory that we have hand sanitizer in our store for customers?
I would say it is not mandatory. It would be based on your policies and procedures that you have created for your business requirements around cleaning and protective measures. Most businesses and their policies do have hand sanitizer as part of their business requirements for employees. I would say that's the component that's required. It is not required that you have hand sanitizer for your customers. But if you put it in your policy and you've implemented that, then you're going to have to follow through with that, correct?
Yep.
But it is not a requirement from Public Health Madison Dane County that you offer up hand sanitizer to customers, only to your employees and staff.
And I have seen some small businesses that not only there's not only sanitizer, and let's just be honest about this, it protects you too. So when you put it out, it's not just for to keep your customers safe, it's to keep your staff safe. If somebody, most of the small businesses that I have gone to pick things up, curbside, whatever, you walk in, there's sanitizer right there. You sanitize your hands, keeps them safe. But also if they're going to be picking up and putting down product, I think it's a good idea. I've also seen a number of businesses, and they're not that expensive, but they do provide those medical grade masks with the, the nose piece. And they've had them at the door. And if for some odd reason you have a cloth one and it's dirty or whatever, it's just a gentle reminder to wear a clean one. So, again, like you're saying, mandatory maybe for employees, it's part of your policy, but not for staff. But just because it's not mandatory doesn't mean it's not a good idea.
Right. And I would say anytime that you have cues for that type of, cues for success for the behavior we want, which is hand sanitizing often, wearing face coverings, anytime you have those resources available and cues for that, whether it's for your staff and or customers, you're going to have better success in that space. And again, one of the things I wanted to bring up is in a retail space, everybody I shouldn't say everybody, but many people ask about the fomite transmission that can happen because of COVID-19 and people touching surfaces. If we're hand sanitizing, it's a non-issue. So by having the hand sanitizer available for your customers in a retail setting, that actually is a really great protective measure to prevent the transmission from touching inanimate objects and ourselves, just to have that available. So yes, I still think it would be, if it's possible for a business to offer hand sanitizer to customers, that's obviously the best outcome for everyone.
Yeah. And again, a lot of these things we can get local, even if, they're difficult to get on a retail, but you can still get them wholesale. I know we've bought lots of PPE from Easy Office Products. They deliver it touchless, contactless delivery. You're supporting another local business. I would suggest checking them out. You order online and they deliver, but they have all kinds of things, shields, whatever you feel that you need in your business. The question is, how often should we be sanitizing in our businesses, but like the physical space? Should that be done? I know that's part of the policies, and one business reached out and said they didn't include that in their policy and procedure, but they feel they should be, and I couldn't agree more. I think, like, of all things, that's super important. That's it. Is it every 24 hours? Is it every night? Is it every morning, every night? What are your thoughts on that?
My thoughts are it's really going to be based on how that space is being used and how many people are entering that space. And we would say minimally before you begin in the morning and at the end of the day. But we also know that during COVID-19 that those policies should be heightened cleaning and sanitizing. So depending on the use of that space, it could be as often as every half hour on touch points, every 2 hours throughout the space. In a restaurant, we say every 2 hours throughout the space and every 30 minutes for touch points, like on a beverage machine. And those are just some examples. So each business owner is going to have to evaluate their space and the traffic that they have and determine what makes the most sense. But we should be doing heightened cleaning and sanitizing of those touch points to prevent the spread of COVID-19.
Great, thank you.
And I do agree with you. It should be whatever is decided upon by the business, that should be incorporated in the policy, and everybody should be trained accordingly, and it should be abided upon.
Okay. So you and I chatted last week specifically about one business, and I don't want to name that business, but I want to roll through what happened because I learned some new things. So they had a staff member that tested positive. That person was at work in the morning, went and tested, tested the prior day, found out the next day that this employee was positive. The business owner thought she had to shut down the store. And she did the right thing by going to get the rest of the staff. Like, they immediately went and got tested. Everybody else came back negative, but she closed her store down for a number of days. And my call to you was, is that necessary? And your response was?
No, it is not necessary to close your store down or business down when somebody tests positive. However, if they had tested positive and they had worked within 2 days prior to that positive test or symptom onset, the space that they worked in should be contained and cleaned and sanitized. So there's a couple ways you could do that. If it's a space where nobody else utilizes and you don't need it, you could just quarantine it off for 24 hours and then go in and do the cleaning and sanitize. That's the safest way. However, if that's not the case in your business space, you would just want to wear the protective, whoever's doing that cleaning would want to make sure they're wearing the protective equipment for that cleaning, and they could go in and clean and sanitize, and then it could be business as usual. When you hear businesses closing down because there was a positive person, it's typically because there are so many other close contacts and they don't have enough employees left to continue operations. So that's the other part of this, is we know that businesses are beginning to experience employees that are positive. And so think through how you're managing your business. Re-examine how people are coming to the space working. Can you stagger shifts? Can you distance them more? Because if somebody is to test positive, the next question is, who were the close contacts that may have worked with them? And if anyone's working less than 6 feet, regardless of face coverings, and has spent more than 15 cumulative minutes, they are a close contact and they will need to quarantine the full 14 days. No testing, nothing gets them out of it. And so you can imagine in a business space where you have a small amount of space and everybody's a close contact, one positive person could close an establishment down.
Mhm. Which is hard, and that's a challenge. When so this particular business owner, in my opinion, did the right thing by immediately closing the doors only for the sole reason of sanitizing, and the owner took literally in the car, took all the staff immediately to get tested. I think that was a really great response. But that is not mandatory, but that should be, in my opinion, part of your policy and your procedure, that if somebody, because a lot of our small businesses, it is tight quarters. Would you, I'm assuming you'd agree with that, that seems to be the logical next step.
I would, and I would also say that to make the most effective use of our testing sites, if you were deemed a close contact in a situation like that, we want you to test somewhere between 3 to 5 days after you were with that infectious person. That's the best time to test. At any time that you become symptomatic during the time you're quarantining, we want you to retest. And then if you want to know whether or not you were an asymptomatic case of COVID, if you never developed any symptoms during your 14-day quarantine, on day 14, you should test again. And it's just really important that people understand that upon being with a positive person, the infectious period is 2 to 14 days after exposure. So just because you go test right away at day 2 and it comes back negative doesn't mean you're in the clear. You could test positive any day thereafter from day 2 all the way through day 14. So again, 3 to 5 days after exposure to a positive person, whenever you become symptomatic, and if you want to know if you were asymptomatic, positive on day 14, if you had developed no symptoms.
That makes sense.
Yeah, and I do think it's really important that individuals who are in a workplace that have been exposed do test. We really want them to do that, but when they test is important too.
So let's talk about the testing. I was chatting with a friend over the weekend, felt okay, but felt had a runny nose, no fever, but certain symptoms. And she went online, to do the pre-registration. And as she understood it, she should have gotten an email back with a code or something showing she never got that. She did it twice. Is there a hiccup with that? Is there a delay with that you're aware of?
There might have been that day. It depends on what testing site they're going to. I work as a swabber, and today I will be doing that today. So if you want to come see me, do that too.
Girl, you're so lucky.
I do that too. I am lucky. I really like to be there and be helping people and kind of calm them. It's a kind of it's a lot of anxiety when you're going to be tested and what to do. But at our testing site, that happens occasionally. If you know that you've done everything you could and it's just not working, you were to show up at the Park Street location to be tested, we'll help you figure that out. If it's at the Alliant Energy Center, it might be a hiccup. And again, somebody will help you out when you arrive on site. But it may not be, it may take you a little bit more time to get through the line. But yeah, sometimes that happens. We've had days where that whole system hasn't worked and we've had to do everything manually, but we still try to do it to the best of our ability to get people, through the testing site, because that's what's most important.
If somebody is not feeling symptoms or really, is staying at home or what have it, should everybody be going to get tested anyway? Because you could be asymptomatic. Does that clog the system?
We want people to be tested who have been determined to be a close contact. And again, 3 to 5 days after they've been exposed. We want anyone that has any symptoms of illness to be tested, because what we're learning is the symptoms for COVID are different in everyone. And so many people say, well, I just had a stuffy nose. I felt like I just had a cold, or I just had a headache. If you don't feel well, get tested, because we're finding that people who have those types of symptoms are testing positive. So it used to be, we had like these are the symptoms of COVID. If you have them, come in. Now we're saying, if you have any symptoms of illness, get tested. If you've been a close contact and you don't have any symptoms, we would want you to be tested, again, 3 to 5 days and 14 days. But if you're just testing weekly, just for precautionary reasons, that's fine. We're not telling you not to, but that may not be necessary at this point in time for our community.
Okay.
So,
and so you're also working, as I understand it, there's procedures and things going on at Monona Terrace where they're doing the recount, which has just got to be an overwhelming job. But that's also something your office is handling. I hadn't even thought about that.
We have some oversight. We are partnering with that, with the recount to make sure that they too are implementing the business requirements and all the policies around hygiene, employee illness, cleaning, and protective measures, just as any of the small business owners on this call today.
So I don't know if my chat box is not working properly, but I don't see anything else in the chat, any other questions. But as always, if anyone has questions after this call, you can reach out to me or you can reach out to Bonnie directly. Just know that she has more than she can say grace over right now, probably cooking Thanksgiving dinner as well for your family, I assume, because you got to put that on your plate.
Yes, that's right. Remember, just the people you live with, your living unit or household is who you're going to be gathering with for this Thanksgiving. And that's really hard for us. I mean, this is a hard time to be entering the holidays and then to realize that we're going to even have to limit our ability to gather with our loved ones that do not live within our household. That's really hard for all of us, and everyone here at Public Health is also experiencing those same hardships, but we're really hoping people get creative and do virtual Thanksgivings and realize this is just a moment in time, but so important to follow through with that so that we can have many, many Thanksgivings together in the future and just be diligent about this Thanksgiving doing the right thing by the orders. And I just want to say that, the reason why we did these orders is because so many of what the positive cases in our community and what we're hearing from contact tracers is that people are contracting COVID-19 from gatherings. And a lot of these gatherings are just with friends and family. And that's really hard to hear right now as we're approaching, Thanksgiving this week. But it's really important that we hear it and we understand it and we follow through right now so that we can keep everyone safe, especially our loved ones, right?
Mm-hmm.
And I also want to touch a little bit about retail businesses and retail spaces and holiday shopping and how these orders impact those retail spaces. There's been some concern that those retail spaces can't operate right now because people are gathering, and that's not true. Our orders are for the definition of mass gathering, and that's when people gather at a moment in time together. But retail spaces are not viewed that way. And the reason why is when we go shopping, we're shopping. We should be shopping with ourselves or just our household or living unit when we go. And when we enter, we should be doing the right thing by wearing our face coverings and distancing, moving quickly through the space, getting what we want, and checking out. Certainly, we want to encourage online opportunities and pick up options at this point. But if that's not possible, we want to encourage everybody to shop locally this holiday season and keep those safety measures in mind.
And I would add, I thought this was something cool. I went and picked up an order from a downtown business, and they put a sign on their door, what their capacity was for having people in the store. I did end up, waiting outside, quite frankly, 2 or 3 minutes. So when somebody came out, they did have a staff member at the door doing a count, which I thought was super organized, made me just feel great entering it, that this was important to them. I did conversely, last week, I had to run in and pick up an order at a box store, just ordered online, picked it up, couldn't find anywhere else. And said to this customer service gal, I think, are you guys at 25% capacity? Because they were way over, I'm confident. And she said, they don't care. So there's the difference, right, between our small businesses and our larger businesses, what our small businesses can do that's meaningful to our community. So if you do have a store, I would encourage you to put that number, whatever your capacity is. And if they need to wait outside for a few minutes, I hope everyone felt like I did, like I'm all in for that. I want safety first. So I would just make that suggestion because it did not bother me to wait. Hopefully it won't bother your customers either. But I thought that was a great idea because otherwise I would get in there and I don't like the feeling that I know they're over capacity. It makes me a little nervous. And so you're kind of in and out quickly. I also think it's reflective of the business, to be honest.
Yeah.
And
And those businesses, because we have these order requirements around capacity, businesses should know what their capacity is, what they're allowed to do right now. And I think it's great that they post it because they're showing they're committed to it, but they're also telling the customers who are coming there what that capacity requirement is. And we do a lot of compliance checks on complaints of spaces, business spaces that are not meeting the capacity requirements, or if it's a business, and this doesn't apply with these new orders, but a business that might not have been meeting the number requirements. But to give you an example, right now restaurants only can have 25% seating capacity indoors with spacing, and everybody needs to be masked at all times unless they're actively eating or drinking. And if a restaurant isn't enforcing that and doesn't know what that is, they can get in trouble pretty quickly when people are coming to the door, right? And we've seen this happen in our compliance checks, and we work with those operators and explain to them that they need to know what 25% is, and they need to know how that looks when they are spreading people out throughout the space with the physical distancing requirements. So I just want to encourage all businesses to think about their space, determine what that number is. I love the idea of posting it because it's setting the standard for the customers who are visiting. And whenever we cue people to what our expectation is, we're going to have a better outcome for behavior.
Yep. Two final quick questions, Bonnie. Is there any info on what's included in the amended order 10 that came out on Friday? And I believe that's posted on your website. There's a link to that order. Is that right?
There is, and there's actually, let me see if I can find this link for you really quick on my computer. I'm going to send you a link that talks about the difference between the previous order and the order that just came out. So I'm going to send that link and put it in chat right now. This is where I'd ask everybody to go. This link here is talking about where we were in order number 9 and where we are in order number 10. And we came out with order number 10, which really, it's the only change in order number 10 is the indoor gatherings went from 10 to 0 and outdoor gatherings went from 25 to 10. But we made another amendment on Friday to just create clarity around that. When we're talking about indoor gatherings, it's any gathering with anyone outside of your household or living unit. So it includes friends and family that we may be meeting up with in private spaces, that, in private residences. That can't happen right now either. And then we cannot have businesses beyond the one-on-one service that I was describing be having any gatherings like the training that Denny brought up. It's unfortunate, but that cannot happen at this moment in time indoors.
Mm-hmm. So I will post that. Did you email that link over? Or
I'm sorry, did you not see it in the chat? Oh, maybe it to
my
me to
chat might be
Denny.
funky.
My
Okay.
chat, let me see if I can do it again. My chat's doing something private to Denny.
Oh, that's the lower left. If you hit to, should say to everyone, maybe.
The
You
lower
have that
left
option.
to everyone. Let's see. Everyone. I'll do it again. All
Thank
right.
you. Thank you so much. And then Kim, you'll be able to find the info that there you go, Bonnie. Thank you, that you're looking for. And I just checked my email to notice you had a PowerPoint, but I think we're doing good, unless there was something on there that you wanted to specifically show.
No, but I think what I'll do, since our time is limited, I'm going to send you that PowerPoint and then some links that I think are really important for businesses right now to help provide clarity around these orders that would probably be helpful and answer a lot of questions. The biggest thing I want to leave you with is, if you're a business, if you haven't had a positive employee yet, the likelihood is you will because of the community spread right now. 1 out of 100 people are testing positive for COVID in our community right now. So I think it's really important that you're prepared. And I'm going to send you this in the chat too. This is so important that you have this document. And actually, I don't want you guys to print it out. I want all of you to know the link that I'm sending you here. This link is to the document that we update regularly about what to do when an employee tests positive. It even talks about, how do I clean the space and sanitize? Exactly like the discussion we had earlier. Everything you need to know in a situation like that is captured in this document. Don't print it out though, because we do update it often and we add different and new scenarios. But that is really, really important for every business to have right now, because we no longer, as a public health department, have the ability to contact trace with businesses. So when there is a positive person, we are not going to be following up with their employer anymore. So it's the employer's responsibility to know how to contact trace within their business and to make sure that the positive person is isolating, and that those who are deemed close contacts that worked with that positive person 2 days prior to their symptom onset or positive test are quarantining for the full 14 days. So that is, if there's one message I want everyone to hear loud and clear, and information I want everyone to have, it's that document.
Thank you. And I will put all of those links as well as if I can, if you need, if you want the PowerPoint, let me just put my email down here. That I don't think I'm going to be able to share that, but otherwise the links I'll share on the Dane by Local members only page, and you can pick them up from there if you didn't grab them off of the chat. Bonnie, as always, thank you for everything you're doing. I know you're running hard. I hope that on Thursday you do get a chance to kick back, enjoy some turkey. And I know you love football. Just she's got to get her football fixed. But thank you so much for everything you do. Thank you for being here today to clarify these. We are recording it. We will share it with other business owners that were not able to be on the call, but we just are really grateful to you and your team.
Well, I feel the same way about you and everybody on this call, because all of you are doing all the good and right things by the order requirements, and everything that we're doing collectively together is going to have a better outcome for the health and safety of our community. So thank you, all of you, for doing everything you're doing.
That will continue. Good partnership.
All right. Be safe
Thank
and be
you.
well.
Happy Thanksgiving.
Bye.
Bye. Colin, back to you.
Yeah, I think we're good to go. I don't have anything else. So it sounds like Peggy, you'll get the information up on the members only section. If you haven't joined the members only, just search for it on Facebook, and I'll get you in there so you can see the information. Otherwise, we will plan on regrouping next Monday at 10 a.m. Thanks, everyone. Have a great Thanksgiving.